As far as concerns of excimer laser refractive surgery, it is surgery which is done already 40 years, so we have a lot of experience with. And at the beginning it was superficial, then came intracorneal surgery, but both possibilities are used and both have some advantages and disadvantages, as everything. Refractive surgery on the cornea is done generally in situation when refraction is stable, and it takes sometimes years, and usually it's done in age over 18 in adult to be able to make their own decision. Exceptionally, in some cases when it's a great difference between eyes, it's done in children, but it is really not to remove diopters to get rid of glasses, but to allow development of vision, so it's completely different and it's not regular surgery. So regular refractive surgery by laser is done nowadays in millions of patients all around the world, and it is probably the most successful and most elaborated type of surgery at all. So it is very safe. Advantage of superficial surgery is that it takes only small part of the cornea. We can correct much more diopters, and we don't cut the cornea and make a so-called interface inside the cornea. Advantage of LASIK, how it's surgery called, is that it's not maybe so painful, but it has another troubles, and one of them is that this flap can slip anytime later and can make a lot of problems. So we are much for much less invasive surgery, which can be repeated if necessary, more easy. So we prefer safety, and it is our philosophy. Range of diopters for correction depends on refractive error, because it's much more easier mechanically and so on to remove or decrease myopia. It means short-sightedness when patient does not see well on distance. Those can be corrected quite easily, up to 8, even 10 diopters, depends on the cornea. As far as concerns of nearsightedness, patients who see relatively well on distance and not good on near, and good results are, even with top modern lasers, relatively good up to, let's say, around +3 diopters. And there is third refractive error, it is astigmatism. Sometimes it's called cylinder, when the shape of the cornea is not spheric, and it can be corrected up to 5 maybe diopters. Depends also on combination with myopia or hypermetropia, so it goes together. Eye is a living tissue, and it means that despite that we do excellent precise surgery, shape of the eye can change. So generally there is no return of diopters, but they can slightly change in some years after surgery, as everything, because all of us, we don't stay the same the whole life, sometimes, unfortunately.